We are seeing an increase in COVID numbers. Let's welcome Dr. Marlo Hernandez of Cano Health, the sponsors of this next segment, as we learn more about the new variant that is spreading. Welcome to the show. Tell us more about the new variant that's out there right now.
Well, it's very concerning because this new variant is more contagious. We think it's milder because it's about half the incidence of that very serious disease that leads to ICU in some other countries. But we don't know that yet here in the United States. But we do know is that it's still very dangerous. It's still COVID, and it's more transmissible. And particularly for those who have not had their boosters, they're more likely to get it than other variants. And that leads me to a conclusion that we're going to see hundreds of thousands of cases over the next few days even. And this Christmas season, this holiday season, we're all getting together, we're all in this COVID fatigue. It's very dangerous, so we've got to protect ourselves.
Okay, so what can we do to protect ourselves?
Well, beyond just hiding out in a cave,
right?
This is what we can do. We can get the booster.
Okay.
If you've been vaccinated, and that means after 6 months of your original vaccine series, getting your additional dose. Or you can certainly protect yourself by wearing masks, the physical distance, limiting that physical contact. That is something that we certainly can do. The hand hygiene, everything that we already know. But it's not like I can give you a pill to prevent it today. Now, there are some medicines in the horizons to treat it, but it's much better to prevent, because you know that always that onset prevention is better than the pound of cure.
Let's go back to some of these pills that we're seeing stories about. That what do they do? The pills minimize the effects of COVID? What do these pills do?
Well, just like the vaccine, actually. They're antivirals. They prevent replication of the virus. So the vaccines, what they do, they neutralize the virus. It's all about decreasing that viral dose that your body has to fight against so that your body can get rid of it. It's not like we can get rid of it for you.
Okay.
And so what we're seeing in the new pills, whether it's Merck or Pfizer, we're seeing 80–90% effectiveness against serious disease or illness, even lowering mortality. And that's very exciting, but it's certainly not 100%. And I'd rather be vaccinated. You still have a chance of getting it. And if you get it, then you get Regeneron or one of these new pills to help you get through it.
Okay, we have to wrap up, but I do have one more question, because the holidays are here. A lot of people have been planning get-togethers with family, traveling to visit family. Recommendations if you're going to go see family, or if you have a large Christmas gathering coming up. What's your recommendation? That's
really tough, because if there's something we've learned from COVID is the importance of relationships, of that connectedness. Virtual can never replace it, but let's try to minimize it this Christmas season. Let's definitely wear our masks whenever possible, and let's get that booster. That's the way to show your family love.
I love it. Doctor, thank you so much for joining us. We appreciate it. And thank you to Cano Health for sponsoring this segment. For more information, call 702-848-2875 or visit Cano Health.